Hello my dear pharmacist friends, welcome to this new pharmacy MCQs video. In this video we are going to discuss a new set of 10 MCQs, so stay with me for the whole duration of this video. Thank you. So our first MCQ, statins anti-hyperlipidemic drugs should preferably be administered. So options are given: on empty stomach, with meals, any time of the day, first thing in the morning, or before sleep. Actually, statins can be taken at any time of the day and without regard to meals. So, these anti-hyperlipidemic drugs can be taken at any time of the day. But the thing is that the patient has to take it at a certain time of the day so he can remember taking the drug at that exact time every day. And it will also help in therapy compliance from the patient side. So, statins can be taken at any time of the day. C is our correct option here. The next MCQ, mesoridazine is indicated for the treatment of depression, insomnia, ovarian carcinoma, schizophrenia, or respiratory depression. So, mesoridazine is indicated for the treatment of, actually it is D, schizophrenia. Now our next MCQ, which of the following are the active forms of sunshine vitamin? So options are given: cholecalciferol, calcitriol, paricalcitol, both B and C, or all of the above. Actually, calcitriol and paricalcitol are the active forms of sunshine vitamin, while cholecalciferol is not the active form of this vitamin, for it will be converted into its active form within our bodies. So D is our correct option here, both B and C. Now the next MCQ, the congenital disease of cystic fibrosis has defective CFTR proteins which are responsible for the transport of dash across membrane of epithelial lined cells. So options are given: fatty acids, potassium ions, chloride ions, glucose, or amino acids. So actually, cystic fibrosis has defective CFTR proteins that are responsible for the transport of chloride ions. So here C is our correct option here. Our next MCQ, one of the following is a typical antidepressant. So options are given: bupropion, mirtazapine, nefazodone, doxepin, and none of the above. Actually, bupropion, mirtazapine, and nefazodone are atypical antidepressants. So this must be the typical antidepressant, doxepin. So here D is our correct option. Now the next MCQ, one of the following is an anti-diabetic drug: ranolazine, octreotide, orlistat, aprepitant, pramlintide. Actually, among these, pramlintide is the anti-diabetic drug. So E is our correct option here. The most severe adverse effect associated with bleomycin is pulmonary fibrosis, uterine carcinoma, cystic fibrosis, testicular carcinoma, cerebrovascular hemorrhage. Actually, the most serious adverse effect associated with bleomycin is pulmonary fibrosis. So A is our correct option here. Now the 268th MCQ is: the anti-diabetic drug metformin exerts its action via glucose absorption reduction, decreases hepatic glucose production, pancreatic B cells stimulation, reduction of cellular resistance to insulin. or E option, that is A, B and D trio are true. Actually the E option is the correct option here, because it is through all these mechanisms that metformin exerts its anti-diabetic action. It is via glucose absorption reduction, decrease in hepatic glucose production, and reduction of cellular resistance to insulin. So it is through these three ways that metformin exerts its anti-diabetic action. So E is our correct option here. Now our next MCQ: which of the following statement or statements is or are true about doxorcalciferol? It maintains healthy blood calcium levels, used for management of hyperparathyroidism. It is a synthetic vitamin D2, inactive in itself, becomes active in body, and all of the above. Actually all these options are true about doxorcalciferol. So E is our correct option here. Now the last MCQ of this video: what will be the ratio of ionized to unionized species of a weak acid if the pH of the solution is 6 and pKa is 3? So actually this MCQ asks about the ratio of ionized to unionized species of a weak acid if the pH of the solution is 6 and pKa value is 3. Actually this MCQ can be solved via Henderson-Hasselbalch equation, which is pH is equal to pKa plus log of ionized divided by unionized. So it is through this equation that we can solve this MCQ. If we solve this MCQ via our Henderson-Hasselbalch equation, we will get our answer as D, that is 1000:1. That is ionized species will be 1000 and 1 will be unionized species. So it is 1001 ratio. Friends, if you want to watch the proper solution of this MCQ, then please watch this video. Thank you.